Good evening. My name is Musawo, Justine Nakimuli KIGOZI, passionate in talking to people about mental health and well-being. As you all know, I'm a psychiatric mental health nurse here in the UK, a counselor, and also a public health nurse working with commissioning services. So those who was with us last week, we were talking about suicide prevention in young people. Welcome everyone who has joined us. Please share. Hi Carlton. Please share in the diaspora. Please share with anybody that you know is raising a teenager at this point in time. Hi, see you share with loads of groups in the diaspora because we have a special guest this evening. Thank you for joining us, everyone. Thank you, Bright. Thank you, Carlton. Thank you, everyone out there, for loving mind, body, and soul. Thank you for supporting mental health and well-being. It's a very important topic. Just to recap, last week we were talking about suicide prevention in young people. And I thought that it's important to get a dialogue about children up in the diaspora. So that child could be Ugandan, they could be Zimbabwean, they could be South African, because it's important to notice that our children can hold a British passport, but they will never be English. They still need to have an identity, and they search for this identity. If they are confused, this could lead to mental health problems. So this evening, I have a special guest who arrived in the UK at age 17. I won't say his age, but he's actually lived in the UK for a very long time. He's here to talk to us about development in the diaspora. We'll talk about drugs, we'll talk about suicide prevention, we'll talk about knife crime, and how our children get to that. I've been a mental health nurse for a very long time. In my job, I get to go to prisons. I've been to Holloway Prison, Pentonville Prison, Manchester Prison, Walton Prison, name it all. And it saddens my heart to see that the population there has children from the diaspora. And they're not there for petty crimes, but serious crimes of gun crimes, knife crimes, drug trafficking. And the question is, what are we not doing right as parents in the diaspora to do right? More so, the problem is most of our children get diagnosed with mental illness very far down the line, and they don't recover quickly because the symptoms. We tend to hide these symptoms. So this is focus is a lot on young people. So this evening, I will introduce our special guest, Mr. Benjamin OLOYA. He will talk to you about who he is, and he will introduce more because I don't know him properly. This gentleman here is here to talk about growing up in the diaspora. He's been here for over 30 years. He arrived in the UK when he was 17. It's important that when we bring people to our shows, we bring people who have the knowledge and experience of being there. So, Mr. OLOYA, could you introduce our viewers, tell them who you are, what you do, and how long you've been in the diaspora for?
Thank you, Ms. Nakimuli. Good evening, viewers, and thank you for having this time and opportunity to come on here and talk about my experience of living in the UK. My name is Benjamin OLOYA. I came to the UK in the late 80s. I was 17 years old. Currently I work for a facilities company. I'm an engineer. I work in London. I work and live in London.
Do you belong to any organization? Nothing political, but any organizations at all?
Yes. The most active organization that I would say I belong to is a Parkrun group. This is a group of Ugandans. So we've got this group within the Parkrun. Parkrun is a brand name where people go every Saturday and run. just for keeping fit and well-being. So we've got a group within that group called the Ugandan Crew Parkrun Group, based in London. So every Saturday we go out and run, and then sit down and talk about cultural activities and just well-being. The other group that I belong to is the Luo Cultural Group. Luo Cultural Group is, by its name, it's a group that was started by Acholi peers here in the UK, and to promote our cultural values and practices, food, dances, and so on.
Oh, that's really interesting. So, despite being in the UK for a very long time, you've maintained your culture values. Do you speak Acholi?
Oh yeah, of course.
Could you greet our viewers in Acholi?
Oh yeah, Amoru Weng Unacholi Matika Winyo Comedy, and Anwood Gulu. So basically, what I've said is that I greet you all, the Luo speakers. I'm from Gulu.
Okay.
Yeah.
That's very interesting, because today, one of the problems that causes mental health problems is when a child is in crisis in terms of identity. They don't know who they are very confused. A lot of people come in the UK, and basically once they hold a UK passport, they start to believe that they don't want to identify themselves with any culture in Uganda. And I constantly say to people, you can have that red passport, but you need to have an identity, because that's important. It adds value to who you are. It gives you confidence. It gives you self-esteem. You're able to stand out there and say, I'm Justine Nakimuli, I'm British, but actually I come from Uganda. And that adds something to you. I speak Luganda, I eat Ugandan food. Children then don't get confused. We'll talk more about that and how it impacts on mental health. Now, Benjamin, one of the theories of mental health is a social theory, where society impacts on what somebody becomes in life. Some things that happen around people's society: drugs and alcohol, gun crime, what people call being, rowdy, or being not having structure, could cause mental illness. Tell us your experiences when you landed in the UK as a 17-year-old man, a young, promising teenager. What was your experiences? What did you think?
Well, it was obviously a mixed experience of excitement, because you've heard so many stories about London, and here is a brand new environment that you want to embrace, but it soon turned into a big challenge, because you're seeing good things you probably would see on TV, and now you're sort of rubbing shoulders with people who are wearing this kind of latest fashion wear and things like that, and you want to belong in that group. You want to be like them. So that, for me, was, a challenge to try and fit into this new environment.
What sort of pressure did that put you through? Was there any pressure for you to belong to this group of people?
I think the environment itself creates that kind of pressure, because, you don't want to be isolated, or pointed at as somebody who does not belong to this sort of environment. At college, you would want to speak like you were born here, try to lose your Ugandan accent, and things like that. So that caused a lot of confusion. And do I drop my African culture and straight away fit into this new culture, or should I carry on? And remember, coming here, I didn't come with my parents, so I came with my siblings, and that guidance was, they all were still new in this environment, so it wasn't easy for them to guide me as a young adult, and and to be fair, at that age, you assume that you know already, you know so much, you can handle the world. Yeah.
Did that have any psychological impacts on you? Did it affect you psychologically at all?
Oh yes, massively, because the thing is, it's much as I thought of myself as a very intelligent young man, coming here, you go in, you've started this, you've gone into college, starting school and doing whatever course you go into. My challenge was, again, trying to behave like I was already here for a long time, like I belonged here by, naturally. So, it wasn't easy.
Did you have any preparations before coming to the UK? Because during counseling in the diaspora, some of the issues that I come across with children who have to come from abroad, it could be South Africa, it could be Zimbabwe, it could be Sierra Leone, it could be any other country. They arrive here without preparations. And I've had one young girl from Mozambique who said to me, I came to this country in my second year of university. And then I've arrived here and I've been placed in A level, which is year 12 or 13. And her expectations were that she's going straight to university. All of a sudden, she's then placed with people that she's much younger with, that she feels more educated compared to them. There's that sort of conflict and confusion, and as a result she becomes depressed because her confidence is low, her self-esteem is low, her expectations have been bumped. She thought she was going to be in third year university, all of a sudden she's doing A levels again. Did you get any preparations in terms of what to expect in the UK?
No, none at all. Actually, I think my parents were happy that I was leaving the country. Let's not forget that there was that transition, 1986, where a new government was formed. So, and there was just a lot of confusion, especially in the north where I come from. So, that was the only preparation. Is you're going into a new environment. Make sure you do whatever you can, and that wasn't enough because they did not actually give me what to expect on arrival here.
So you've described some pressures when you arrived. Of course, you want to have an accent like a British person, but you've just arrived from Uganda. You want to dress like them. You want to belong to a group of people, but you're an external person because you're just arriving into this formed group. Did you feel the need to share the pressures you are going through with your brothers and sisters to see if they're going through this? And how did that psychologically impact on you in terms of mental health? Because some of the suicides that we find in young people, they don't share this information. They think they can deal with it. They think they can handle it. Then all of a sudden, you would find that they start to research on how to end their own life because they are very unhappy. Did you feel the need to share these with anybody else?
I think I would say that probably the advantage that I would say I had over maybe the young youth of the day is that very quickly I started meeting people who were, youth that were, from Uganda as well. And then formed our sort of exclusive group. So our behavior was based on what we knew, growing up in Uganda. So we did not completely lose the cultural value and the practices. We still, and that I think helped me transform from, being in Uganda, in that sort of melee of, 1986, change of new government into this new environment. And meeting a few friends and starting to, interact with other African youths, not necessarily just from Uganda, but, I had a few Nigerian friends who were probably in the same sort of, trail. They were lost as well, wanting to find their new identity and, try to fit in. So from that perspective, that did help me.
Great. So during that time in your journey, did you guys know anything about mental health? Did anyone, experience any mental health problems that you probably look back at, that was
89.
89. So you look back around 89, think, oh, this person must have been really unhappy, or is there something that you experience that you think that the culture intermix might have contributed to that person's breakdown or pressures?
Yeah, I think as part of our new experience, of course, all of a sudden you are independent. You can go and buy a drink, and you can do all these things, and to an extent, it wasn't all because you wanted to create that experience. It was more to do with the pressure that you were feeling. I used to smoke, so much. Coming, and imagine I was just 17 at the time.
But did you enjoy the smoking? Or...
Well, to me, it was. It gave me that good feeling that, all right, after smoking, I felt like, okay, I feel good. So, yes, it was enjoyable at the time.
Is it a habit that you picked up because people were doing it, or is it something that...
Of course, of course, I started meeting friends here, like I said, and of course, some were more experienced than I was, and you pick up these habits, whether it's cigarette or drugs, you would feel, okay, let me give it a try, and yes, out of that group, a couple of friends, I could see that they were so mentally absorbed into, this confusion of new culture, new environment, and new behavior.
And did you have any mental health issues as a result of that, or was that something that was not observed in the 80s at that moment in time?
I couldn't say that it was extensively something that I was aware of. But I think when you're a part of a group, you think, even if you actually veering to the left, you think that you're doing the right thing. But it's only now that growing up and starting a family and all that, you look back and think, okay, so perhaps the pressure came from this kind of involvement.
So during that time of growing up, the biggest problem these days that we see, most of the children that I've met during counseling, their main issue is the time with the parents. So they feel that there's no time given to them as children, and it's sad because in the diaspora, not a 9-to-5 job. People do shift work. People, work around the clock. It's like a wraparound service, really. You've got to run around to ensure that you support your children, but also earn, a living. A lot of I remember meeting a young boy in Feltham Young Offenders Institute. I think it was about 2009, and it was a shame, because this was a young boy in that institute at that moment in time. But he actually described, he was from West Africa, and he described jumping out of the window when his mom went to do night shifts. So in the 80s, when he was a teenager in the 80s, was gang lifestyle pronounced? Guns and knives, drug trafficking? Because these days what we find in the diaspora, you meet a young teenager in the diaspora or early 20s, and they're driving a Range Rover Evoque, top range, and they have no job, but actually they're involved in drug trafficking. A few months down the line, they're in prison, and their parents might not be aware of this situation. But when, as a nurse, or when you go to assess them in prison, you actually find out that they started psychological problems at a very young age, but nobody noticed. They then start using drugs to medicate their feelings. What they feel, they want it to stop, and they use drugs to self-medicate. And once a drug dealer realizes that you use drugs, they'll start giving you free drugs so that you can sell for them. So they give you to sell, but you don't have to pay for yours. And by the time you know it, their children are hooked to it. But when they get arrested, they will not grass the drug dealer up. They will take the blame. And then I find them in prisons struggling with all these emotions. And it's, most of them parenting and how they were not able to sit down with their parents and discuss these issues and what they were going through. What was your experience during that time in the 80s?
Well, like I said earlier, I came here I would say I came here alone, with no parental guidance. But the support that I had from my older siblings was immense, and that sort of kept me in check. Yes, I was part of I would say, a gang group.
Was that a Ugandan gang children?
Yes,
or?
Yes, these are all Ugandan youth. So,
was it a gang, as in a gang of chaotic gang people going robbing and doing things, or was it a friendship pack?
Well, a bit of both, to be honest. Yeah, but it was more a feel good. A feel-good gang, if you like. Because we would, on weekends we would play football, get together, and at the time there was lots of house parties. So, in a way, our needs were sort of met in those kind of activities, and we were not sort of idle for too long. And of course, guidance from older siblings and friends, who were much, that kept us in check. Now, I think, you did mention about, parental guidance. That is very important because I keep very close to my children, and let them know, one, the values of being Ugandan, whether they practice the cultures or not, because their identity is actually Uganda, whether they like it or not. And it's upon us, the parents, that can actually ensure that our children grow up knowing and keeping that identity. And that sort of makes their development a lot easier as well. And their performance in school very, very positive. So, keeping check with their children and, keeping it close. Yes, we've got these gadgets at the moment where, all our children have got iPads and, smartphones, but still knowing what they are doing and always sort of having a conversation with them whenever you can does help, and it goes a long way to giving them that guidance.
This issue, you touched a little bit on culture intermix, and for me it's an issue as well, psychologically and physiologically. So you've mentioned parental guidance. We have been brought up in Africa. There are ways in how we've been brought up. One of those things, I know that I never question my parents because they are right in all ways. So in many, many, many ways, a child who is brought up in Africa, you'd have limited choices because those choices would be made by your parents. Children here are taught to be independent thinkers. So from day one, they probably know what they want to be. They know what they want to, to do. While we grew up and your parents would say, I want you to be a doctor, I want you to be a lawyer, do this. And there was some sort of, structure in the family. This must be done this way. This must be done this way. And through via counseling, most of the children that I meet, a parent could say to you, this child is rebellious, they're not listening to me, they're doing that. But then you realize that the parent is using a very containing method to manage, this child, other than an engaging method. And sometimes people say, oh, but Musawo, these kids are ruling us these days. We should be able to keep them in check. How do you think parents of this new generation should work on engaging their children so they can know more about what's going on in their lives and what they're going through?
Well, I think it's important to keep to develop that sort of friendship and freedom between you and your child, because if you don't have, if your child does not trust you, if it's just a case of telling them to do this, telling them to do that, they will play that close role where hide and seek. If you don't ask, I won't tell, or if you ask, I'll give you a limited information. So I think being closely involved with your children in terms of interacting with them, taking them out, and as well regularly taking them back home and letting them see how the cultures back home compares to the one that they live in, because they are, of course, the second generation of Ugandans here. So they are actually, if anything, torn between a culture mix that we've shown them, and the culture that they are growing in. So it's our responsibility to make sure that we are closely interacting with them, asking them questions, and of course it's important that we let our children sort of explore what they're good at. You're not going to force your child to to doctor or an engineer when you know that they may not have the potential or even the interest. So it's good to let them explore what they want, and then you guide them that way. And that's what I do with my children.
Right. So for those who have joined us a bit late, just to recap, last week we're talking about how children struggle to break through being autonomous and finding identity during their teenage days. And some of the research we've got says that has contributed to suicidal thoughts and depression in young people. So we felt a need today to bring somebody who's been in the diaspora for a very, very long time to try and engage on how those impact on children. So Mr. OLOYA,
Yes.
Benjamin OLOYA,
Yes.
just gave us a few tips. He's talked about some of the pressure he felt as a 17-year-old coming from Uganda. That's over 30 years ago. Or as a 17-year-old coming from Uganda, and the pressures that he felt to fit in. There was peer pressure. There could be bullying. He felt that he needs to speak like a British, but thank God he speaks Acholi now. He still speaks Acholi and belongs to the Acholi Luo culture group. Yeah, Luo culture group, which is a brilliant thing. He's emphasized the need for identity for our children. The problem with lost identity is that you've got a lost child. And a lost child is one that never finds value in themselves. And if a child does not find value in themselves, their performance in school will be poor. They'll be self-critical. Their confidence will be very low. Their self-esteem will be very low. And in the long run, the prognosis is they might be depressed. And that's not something that we want for our children in the diaspora. I did mention that for the number of, every time I've gone to a prison, it breaks my heart to find a child of a diaspora. It could be Zimbabwe, it could be South Africa, but you find a child there, not for petty crime, but for very, very serious crime. And we're looking at some research on Black and ethnic minority communities and parenting, and there's a group of people that has very high numbers of children being looked after by health and social care. So this is children in social services. But it's very interesting that the Asians have the lowest percentage of children under health and social care. And when you look into that, the Asians preserve their culture. They preserve their cultural identity. Did you know a child born here by Bengali parents speaks Bengali? Did you know that? But then we have children here and we don't want them to speak our language. They cannot identify who they are. They are in crisis most of the time and they don't know who they are. They do not visit our home countries. And as a result of having that no identity, lost identity, our children suffer with depression, torture because they don't know who they are. Mr. OLOYA, we will be concluding our live today. Is there anything at all you've got to say to our parents in the diaspora?
I think just to conclude, I think it's important as parents. I'm a parent, so it's important, like Musawo said, to make sure that our children cling on to the identity that we have. I mean, we are Ugandans. It doesn't really matter, or we are Africans. And whether you've been here for 50 years or more, you're still African. So, and the only way that our children are going to excel and perform better and become responsible people is to make sure that they have an identity. It's very important. I mean, we all have an identity. The reason why we've got identity, as in the British passport, that is important. And you can see from that perspective that identity is very, very important, and your culture is very important. I, take my children to the Luo cultural group performance. At Easter we do cultural dances, and they eat local food, acholi food. So, and these are things that will keep them knowing that they have a culture, they have, a root somewhere else other than being born in the UK. So that's all I have to say.
Okay, thank you very much. Thank you for joining us this evening, Mr. OLOYA. Thank you for your time. Lastly, for people who are bringing their children in the diaspora from abroad, please prepare them for the journey that they're about to make. Prepare them for the journey they're about to make. Don't just say to them, you're coming to England and that's it. Be very honest about the journey and what is happening and what life is like here. So you put them in the picture. Children can be very excited when they're coming to a country like this, of course from Uganda. For children born in this country, please give them an identity. Do not let them in crisis. Do not leave them in conflict with themselves. Identity will add value to them. It will add self-esteem to them. They will be confident of who they are. They will stand out there and, speak out confidently of who they are. We've got children these days worried about being black. I mean, we've got children worried about having an African accent. We've got children committing suicide because they don't like who they are. They look in the mirror and they don't like who they are. So for me today, I felt the need to bring this out. Me being an advocate for mental health awareness, I wanted to also comment and discuss the fact that it impacts a lot on who we are. The theories out there as well. Impacts of society on our mental health and well-being. This can be, drugs, alcohol, the environment you live in, self-acceptance, friends that you move with, things that you do. All these things impact on health and well-being. However, if we give our children an identity, you have already given them an independent mind. That means even if they find a drug dealer down the street and says, hey, do you want a bit of weed? They'll say, no, because I do not smoke weed. They do not lack that sense of belonging because they know who they are. So, I hope this video today, I hope you share it with the most important people, those who need to hear it and understand it. Thank you for loving mind, body, and soul. Thank you for following Musawo, Justine Nakimuli, KIGOZI. I love you all and do have a wonderful weekend. Ciao.